Thank you very much, Jeff. That was excellent. And thank you to all the presenters. They were great presentations, and they were also within the time frame. I'd like to start our discussion. I'd like to also, in our discussion, focus on the contingent groups. So I think what we've heard is a background to everybody on conformity assessment. And Jeff in particular, still at the last, talked about the flexibility of other organizations. But I think what we really need to do in our discussion is focus on what are the unique needs of this non-traditional or contingent workforce. And I'm sure Andy will have some thoughts on that because OSHA covers the workforce and we are talking on the workforce. So Andy, you want to start our discussion?
Thanks very much, Howard. So OSHA has been dealing with the issue of temp workers and joint employment and gig workers for about the last decade. It's really become of increasing concern. And associated with that is this issue of what's called misclassification, where people try and claim that workers are independent contractors and not covered by the Osha Act to get out of complying with OSHA regs. So that's really been a challenge for the last 10 years. Let me start with a bedrock principle for OSHA, which is that any employee who is covered by the Osha Act has the same level of protection under the Osha Act, the OSHA standards, and the OSHA whistleblower protection requirements as any other normal traditional employee. So that is a key and foundational piece of the way that we approach this issue. OSHA, going back to 2013, started something called the Temp Work or Temporary Worker Initiative, which was some guidance documents that we developed around this issue of how to better address complicated non-traditional employer-employee relationships. If you look on the OSHA website, we actually have some guidance specifically on PPE, and then some guidance that's even more specifically on respiratory protection programs in these temporary worker, joint employment, non-traditional work settings. If you then fast forward to 2016, this had become such a significant concern that as OSHA revised its guidance for safety and health programs for how employers address overall safety and health management, we actually added a whole brand new element number 7, that is all focused on communication and coordination in host employers, contractors, and staffing agencies. Now, the way that we approach this whole issue of non-traditional employment is really around the employers figuring out how to effectively handle communication and how to effectively coordinate OSH responsibilities during around the non-traditional employee's work environment. Now, there are many things that rest with the host employer because they control the workplace. They have the best understanding of the hazards and the controls that are necessary in order to protect those folks. But what we focus on as an agency is looking at how is that employer and those contractors or the temp agencies handling the assignment of OSH responsibilities. And very often you'll see that there's a residue of forethought that shows up in contracts and agreements and communication between the host employer and these other folks that are involved in the employment relationship. And it very often addresses things like training or injury and illness recording and reporting. And then, of course, specific standard requirements like, in this case, 1910-134, the OSHA Respiratory Protection Standard. The other thing that I think would be helpful for the committee to understand is that most of OSHA's standards in this area are performance-oriented standards. So OSHA allows a tremendous amount of flexibility in the way that the employers assure that the employees get the things that are required under the standard, as long as at the end of the day, the requirements of the standard are accomplished. And so to that end, we've addressed this issue, for example, on enforcement memorandums and enforcement interpretations around the respiratory protection standard, where we've discussed the possibility of somewhat more complicated ultimately, but still effective ways of making sure workers get the necessary components of respiratory protection. And so you will see, for example, labor unions, temp agencies, contractor associations, trade associations or professional associations, or in some cases, licensed medical providers handle different aspects of the respiratory protection program under contract or under agreement with the employer. So, for example, they might handle the fit testing, or they might handle the medical evaluation, or they might handle the training component, and then the employer would handle only the parts that were necessary for the actual on-site work. And so there's that agreement that I was talking about, where there's contracts or agreements or coordination between the host employer and the temp agency or the other folks that are involved in this, to make sure that the worker gets what they need. And that's really how OSHA looks at this at the end of the day, is are the workers getting all of those aspects of the respiratory protection standard?